on 88.5 Sufra FM. Tell a friend, call your neighbor. Casualty 911 is on.
A wholesome and relationally healthy family is an integral foundation for a strong community and nation. The many social ills that plague our island need to be comprehensively addressed to stem the tide of depravity and bring about resilient change and healing. With this in mind, 88.5 introduces an in-depth program called Family Matters. Family Matters is a 1-hour program at 11 a.m. with Human Services family caseworker. Listen in for insights and detailed information on core topics such as the disciplining of the child, the integral involvement of men, and the empowerment of women in the family, parenting and associated laws, child and drug abuse, domestic violence, and teenage pregnancy. Call in to air your views and make your contributions on 459-7885 or 459-7888. Family Matters on 88.5 Sufre FM.
30 minutes after the hour of 11 a.m., folks, you know, if it's between the hours of 11 and it's 12 midday, you know, Family Matters is on. And of course, I'm just the moderator. She's your host. She's here. Let me along with her guests. So let's say good morning to her inside another edition of Family Matters. Welcome inside, Miss Renita.
Thank you, Ellen. Good morning, everybody.
Bonjour. Happy Wednesday.
And happy Wednesday to everybody. Yes, October is our Creole month. So bonjour tout le monde. Moi ka gade si person kay kouye hodia. Oui. So moi ka di Creole avant. And then nou kay gade about leading nou ek tout sa lot nou vini fe. So welcome again. I'm hoping today that we're going to have some callers, make it more interesting. With us this morning, we have a very special guest, and again, I want to thank her for coming in. I called her late last night, and she was able to accommodate me, so I'm quite grateful, Nurse. So I will move over to her, let her introduce herself, tell us a little about her, and of course, we will introduce the topic, which is maintaining or the importance of wholesome mental health. So over to you, Nurse Segis. Tell us a little about you.
Hi, good morning, everybody. Thanks for the invite. I am Alicia Segis, mental health psychiatric nurse practitioner. I work at all the health centers from Castries all the way down to Canries, and I help out in Soufrière and Choiseul.
Okay. So you are quite versed with mental health, and hence having you here this morning, and thank you again. So when one hears the term mental health, what does mental health mean?
When we look at mental health, we look at our mind. We look at how we think, how we feel, and how we act. So we all aiming for good mental health. We want to feel good about ourselves. We want to be able to interact positively with others. We want to be able to have positive relationships. We want to be able to look after ourselves, look after our family, contribute to community, accept change, deal with adversities, have good coping mechanisms. So all these things will be components of learning about mental health, good mental
Very
health.
good. So when we look at, I'm happy that you included everything in it, because we said we were looking at wholesome mental health, and that does not only include one aspect, for example, like your physical health, but also your spiritual, your emotional, and so on. Okay. Tell us how one can maintain good mental health.
Okay, so when we look at good mental health, first of all, we should talk about our emotions, be able to label our emotions, know what it is. So if you're happy, if you're sad, if you're angry, and able to find somebody to talk about your emotions and express your emotions. We all have the right to our different feelings, but just the responsibility of how we act. So we know, okay, so you can go and say what you did had me maybe angry, or I was very happy. So you're able to know what your emotion is, and be able to talk about it. So if you're angry, if you're sad, if you're going through issues, be able to talk about it. The next thing too is take a vacation. Sometimes we work, but we need a little time to rest, to take a vacation. That's another important point in mental health. Work. We all have to work. We have to work to survive our livelihood. So we work. We eat healthy. You have healthy body, healthy mind. The same way, healthy mind,
Yes.
healthy body. They're interactive. Healthy. So we work. Practice your spirituality, your faith. You need something to believe in. So practice your faith. Exercise. Accept yourself for who you are. I mean, there are things that we cannot change. This is who we are. So we have to accept for ourselves for who we are. Be at peace with who we are. Have a good support system.
Very important.
We need to nurture a good support system. We need to have somebody that we can talk to. When it comes to the support system, sometimes we're so busy moving along that we do not build that foundation. And when things happen, we realize that we are alone. So remember to call your family member, call your friend, whoever it is that will be that support system to you. Keep them close and remember them. Also, volunteer, help others. They always say that helping others and seeing others thrive gives you a sense of accomplishment that paid work don't do. So that's another thing. So all of these help with the mental health. Also, gratitude, having a positive attitude that will change your mindset. So if you keep on looking for the positive in situations, then that will make it better. So these are some of the components that will help you take care of your mental health. And another one I'm leaving out. The final one is self-care. For those of us who spend a
Definitely.
lot of time looking after others, we need to look after ourselves because if we're
True.
not up to point looking after ourselves, we cannot look after other persons. So self-care is very important. It's not selfish. It's not something we do when we're the point of falling to pieces. It's something that we schedule. If it's weekly, if it's daily, if it's monthly, something put in there so we don't get to the point where we cannot deal with our stress. We feel burnt out.
Thank you so
Yeah.
very much for that, Mr. Jace. Whilst you were speaking, it just occurred to me that something which may be very good for the mental health, although persons may term it to be selfish, is the word no.
Oh yes,
Sometimes. Tell us
yes.
about that.
Yes, saying no is important. That is part of self care. Saying no, saying I don't know, saying I need help. These are phrases that would help your mental health. Because if we keep on adding to our stress, we will not be able to accomplish what we have to at an acceptable level and will also increase burnout.
Definitely. I realize that let me not say only St. Lucians, but of course, I'm exposed to St. Lucia. So I'm going to say that I've realized many persons do not like the word no. So yes is an answer as well as no is an answer. And sometimes to maintain your sanity, to maintain your good mental health, it is important to say no or to stop. For example, in my profession, it is, well, in mostly all professions, it is very stressful. Sometimes we need to take a breather. As with any other profession, you need to take a breather where you need to stop. You need to tell a client, please hold on, or I cannot see you today, so you have to come back. Does that happen with you very often in your profession, Miss? And how do you go about it?
It's not easy to say no. And then in my profession, some of the persons you at the point you may meet them, it's very difficult to say no. But thankfully, we have a referral system. So if at the point where I have to say no, I can say no, I cannot, but so and so can. Referral.
Definitely. So we need to let persons know out there, as much as yes, we are the professionals and we are offering the help, we are in a helping profession, but sometimes we are not, sometimes we need to take care of ourselves. So we give the advice out there and then we do not take it. So we need to. I see you smiling. Am I hitting the nail on the head?
No comment.
Yes. So even when sometimes you realize that, yes, the clients need help, persons need help, but sometimes I work and I have a nasty headache. And it is the same as sometimes it's not, like you're saying, it's not easy to say no. And you go ahead, but can you really help and be effective if you are in not if you're not in the right state of mind or if you're not in good mental health?
not, like I say, not as good as if you were in good mental health. That's why guess why we have the referrals. You can refer to another colleague, a different agency, another stakeholder. So it is better for you to be on point,
Okay.
so you can be able to deal with the situation faster and better.
All right. So to our professionals out there, persons who give help, you need help as well. You need to take care of yourself as well. And to clients who are coming to these professionals are human beings and they need help as well. So we all in this together, that mental health is top priority. It is very, very important. Without a good, healthy mental health, then you cannot perform effectively. So our day-to-day practices, the SEGIS, let us look at, for example, I'm going to look at good mental health practices vis-a-vis certain professions. For example, we look at a teacher and we know that this profession is very stressful. How could we give advice to a teacher as to how to maintain good mental health?
We can look at the different. So
Yes.
I will still go back to the same list I gave, where have somebody to talk to, gratitude, and there's also reflection at the end of the day. Take time for yourself, grounding, grounding exercises, and all of these things. So even if it's the profession is stressful, but it comes down to the person, what works for you. Because I may say, I do deep breathing and it works for me. Some person may say music calms me down. Some persons may say going to my safe space calm me down. Some persons may thrive under stress. It helps them move forward. So move forward and work better. So it's not a profession thing. It's an individual thing.
Well said. Very well said. Nasejes. Good. So, as you've heard Nasejes said, you need to find what works for you to maintain your good mental health. So, if at any point you're at work and you feel like you need a few minutes, please take it. Stop whatever it is you are doing. Take a few minutes to yourself, whether it is to breathe, whether it is to take a walk, whether it is to sing a song, whatever works for you. Take a few minutes to do it. What is the correlation where how quickly is it for one to flip from good mental health to unstable mental health messages?
I can't say. I cannot say. It is something that you can say. Mental health is not. I am mental health and your mental health. It shifts along the day to day. So I mean, you get up. Okay. Okay. So we go just now. So mental health is a continuum. It's a line. We go day by day. We go along the line. So you get up in the morning. You're fine. Then you drive all the way down to Soufrière and you answer all these questions. So you're getting a little more anxious, you're going along the line. So go along the line. But in the end, you go back. You're resilient, you're able to go back to mental health. So it fluctuates. It fluctuates during the day. Sometimes you're hungry, you're thinking too clearly because you're hungry or you're tired or you're sleepy. So these things will not cause you to be, you will say, optimal mental health. I don't mean that you're mentally ill, but then you still have a mental health issues where you're not able to think clearly, your reflexes are because you're, but then you may listen to music, listen to a song, get a call from a friend, eat lunch, take a nap, and then you'll be able to bounce back. But then persons deal with a lot of adversity, maybe a lot of loss. They lost their job, lost their partner. Some persons lost their home. They have different little things. Yes, family traumas. These things will take you along the line, where you pass the midline, and then you may need counseling, medication, or if you reach the bottom, which is mental illness, maybe hospitalization or even down to the end there. So it's a line. We move day to day, we move the line. But we want to make sure we stay above the half line. That's why we have to do things to keep ourselves mentally healthy. But when it comes to the diagnosis of mental health, we have the installation, we use the ICD-10, and there's also the DSM-4. These two books, They
Oh,
give
there
you
are books.
criteria. There are books, the written, the criteria. So it will tell you if you're diagnosed or the different skills you can also do. So if they ask, like for depression, it asks you in the last 2 weeks, if you have 5 or more of the symptoms, seek medical attention. Because seek medical attention, like if you feel like killing yourself, if you're feeling if you're thinking about death, if you think you're crying a lot, if you're eating too much or eating too little. So these are questions they will ask for depression. So if you find that you have about, I think it's 5 or more, then they'll ask you to seek medical attention. So, but sometimes when you have 5 or more, that means it's depression, maybe an underlying cause. But then it is something that you not say and label somebody mentally ill right away. It is a series of conversations and observations before you can label somebody.
Series of observation
And conversation. Yes.
Because persons are, you have to be judgmental. They cook to jump. Say like, what? You say food. Things happen. You know, just because you display, maybe you're just out of character.
Yeah, because yes, mental health will have to do with what's acceptable by our society, our culture.
Exactly.
So if it's something totally, it's something different to the society or the culture, it will not be deemed as normal.
To somebody that's taboo. You know, like,
Yes.
reject it.
Very true. And thank you for that, Ulan. And my question, Nusajis, why I said this, is that we, like Ulan said earlier, like some persons, they want to discriminate. Like two people, mental health or having a mental illness or mental challenge is for one set of persons. Like certain people are like that and not others. So I ask that to state that anyone can suffer from mental
Not
health
suffer. The persons,
challenges.
they're not suffering, they're living with mental health conditions.
Yes.
So we need to change the word. We need to change the word from
Okay.
suffering. You don't suffer with diabetes. We live with diabetes, we
live
high
with
blood
it.
pressure, we live with mental
Right.
health conditions.
Thank you.
Yes, we have to change it. So we don't say like the words crazy and fool and all of these things.
Right.
They are maybe disturbed, maybe confused at the moment, disturbed, displaying. So because persons, like you say, a lot of stigma and discrimination with these words.
Attached,
So
right.
they're not suffering. They're living with the
They're
condition.
living with it.
So when you say you're living with it, that means you're managing to the best that you can do. You're managing. Whether you're suffering, that means you're low suffering,
Yeah.
right?
Yeah.
So the best that you can do.
The perceptions. So thank you for that. All right. So when somebody's living with mental health challenges, the family also would be affected. How do we reach out to the families and guide them in terms of giving them tips on how to go about for their mental health as well?
Okay. From what I've noticed, it takes a while for the family to accept that the person is living with a mental health condition, because you find that they will, especially for our St. Lucian culture, they say something somebody do them or something that they go to the
Right.
faith-based organizations, and then when they cannot manage it, they reach to our system. But person who living with a mental health condition, the earlier they start getting treatment, whether it be medical, whether it be counseling, the better outcomes. The better the outcomes. And what I can say to the family members, be involved, know the condition, go to the clinics with the persons to ensure that they go to the clinics. Check up on them. You take your medication already. You go to your counseling session. What day is your appointment day? Let's go. Ensure that they take the medication. Ensure that they rest well. They have opportunities to rest. Ensure that when they know the condition, then they'll know that signs of relapse. So sometimes, even if the clients are on medication, due to external stressors or internal stressors, they may start showing signs of getting ill. So know what to do when this happens. So if I say, okay, well, I realize you're not doing well. I think we should go and see the doctor today before things get worse. So it's a conversation to have with persons living, and especially have these conversations when the persons are they're settled, they are stable. So you can know, okay, well, if what will we do if we notice that you're not getting well? So the persons will say, okay, if you're not getting well, then I'll bring you to the hospital or I'll bring you to the doctor. So if this plan of care is in place, then when the person is actually falling sick, then we can do something about it before they relapse so far back. Another thing too is that some persons, without the family involvement, some persons need the family involvement for them to get better. Majority of persons, we find a lot of persons, they go, they admit at the hospital, they come out, they don't take any medication. You don't hear for the family members. They'll call you and say, nurse, so and so is acting up. I need this is thing. You come from the hospital, come nurse. What is the next step? How can we plan the care so that this person can function in society and be productive in society and be the best that they can be? Let's plan the care. It's not that you just come out and leave it and then start relapsing, come back. No, let us plan the care. That's what is it that we have to do? What is it that he has to do? Let us sit down, all three of us, and let him decide or her decide what is it that they want to do to remain that the best person that they want to do. Like I said, it's not because you're diagnosed. There are variant levels of mental health issues, but not because you're diagnosed with a mental health condition. It doesn't mean that your life is over.
Definitely.
Okay, we just have to work together with your healthcare providers, yourself, your community to see you can be the best person that you can be in the situation.
Definitely. Now, we normally persons who suffer with mental persons who live. I'm correcting myself, and thank you. We learn every day. Persons who live with mental health challenges. Okay, you will find that a plan is in place for the persons who are living with it. But what plans can be put in place for the family members? Because what you find is that the family members do go through a lot, especially if this person who have the health challenges is like solely dependent on maybe one family member or two family member. This family member may start feeling cornered and burnt out and so on. What are some of what are some of the things, activities, plans that this family member can engage in, or plans they can make for when they start feeling the burnout and cornered and so on?
Okay, so caring is about caring for the caregiver.
Yes.
Okay, so one thing we have to, first thing for the caregiver, to me, if there's a family, if there are a lot of family members, the caregiving should not be on one person. If there is need for caregiving, it should be a shared activity. And the caregiver needs to look after themselves. They need to have their regular doctor's visit. They need to share the caregiving. They should take opportunity for rest, opportunity for social activities, opportunity for vacation. All of these things should be included. And self-care. They should put self-care in there. So if a person living with mental illness, if the person can function in society, you'll be okay. Well, if you have brothers, sisters, family, okay, well, this month is your turn, that month is your turn. So we put it around, so not be all the stress on one person. And sometimes the persons can't function without somebody looking at them. Sometimes you just have to check in, unless you wish the person, okay, the person is you really have to check in, be with the person 24 hours a day. But most times, just rotate the care. And if there's not anybody else to help you, well, I guess you can. They have the go to the different services, go to the other faith-based organizations. They have the social services. See what SSDF. Well, I think they do the elder care. I know for the elderly care,
There's
the elder care program. But then see what there is out there that will help you in your caring for your loved ones.
Okay. And something very especially important, reach out for help. Like you said, you feel burnt out, you feel you need a breather, reach out to someone. If you do not have other family members, you can reach out to a friend. And you said earlier, Nasages, that is very important to have a very good support system. And a support system doesn't necessarily mean it has to be family members. It could be friends, it can be colleagues, whoever you can rely on for help. Of course, you should build that with them. Yeah. What are the signs? I know that when somebody is in good mental health, they will appear to be happy, effective, focused. What are the signs of not being of good mental health?
Okay, so not good men.
It's okay to breathe. So, yes.
Okay, so maybe
definitely.
looking at for mental health, we look at
Yes.
persons being confused, poor memory. The person may be sad. The person may be considering self-harm. The person confused thinking, not sleeping, wandering.
Yes.
Let me get my paper.
That's quite fine. Yes.
So,
So, some of the signs that nurses has said that persons may start self-doubting. You may start losing sleep, your appetite. You may lose your appetite. You may be very irritable, whether it be at home or at work, and you certain things that used to make you happy and smile does not anymore. So these are some of the signs and symptoms of not being in good mental health or being in poor mental health.
so I just go through my list to make sure we have all of them. Confused
Yes.
thinking, long-lasting sadness or irritability,
Irritability.
extreme,
Yes.
extreme highs and lows in mood, excessive fear, worry, or anxiety, social withdrawal, dramatic changes in eating or sleeping habits, strong feelings of anger, delusions or hallucinations, which is seeing or hearing things that are not there, increasing inability to cope with daily problems and activities, thoughts of suicide, denial of obvious problems, many unexplained physical problems, abuse of drug or alcohol. And in older children and preteens, you may have abuse of drug or alcohol, inability to cope with daily problems and activities, changes in sleeping or eating habits, excessive complaints of physical problems, defying authority, skipping school, stealing or damaging property, intense fear or gaining weight, long-lasting negative moods, often along with poor appetite and thoughts of death, frequent outbursts of anger. And in younger children, we have changes in school performance, poor grades despite strong efforts, excessive worry or anxiety, hyperactivity, persistent nightmares, persistent disobedience or aggressive behavior, and frequent temper tantrums. These are warning signs of post lifespan.
Very good. So, listeners out there, if you realize that you are suffering with anything that Nurse just read or anything that you heard, please, we need to do some introspection. It's very important that we do introspection on a daily basis. So, you can practice. I was reading and saw that there are some activities that you do on a daily basis good mental health. You could do meaningful activities. These are any actions that you enjoy or that gives a sense of accomplishment. A meaningful activity could be listening to music, watching movies, go for a walk, anything that you like doing. Then we have healthy thinking. Examples of healthy thinking include keeping perspective and talking to yourself with kindness. So many times somebody may see you speaking to yourself. What do they normally say? If you if somebody catches you speaking to yourself,
But someone says speaking to yourself is not the problem, it's answering yourself that's the problem.
okay, they will say anytime somebody says you're speaking to yourself, Ulan. So yes, so these are some of the comments. So speaking to yourself is quite healthy. As I said, you said is answering yourself, and that's borderline. Sometimes you hear people having a whole conversation with themselves, and you wonder what is going on here. But I'm thinking that to some extent, it is healthy, definitely. So goals and plans, having goals is important to keep you energized and motivated. Goals give you something to look forward to and can help to prevent dwelling on past problems. So it's very important to set goals. Healthy routine. Keeping up a healthy routine doesn't need to be complicated. It can be as simple as going to bed and waking up at the same time every day, or a routine linked to our worlds and relationships. our social connections. Staying connected to friends and family helps you to feel validated and reminds you that you belong. Okay. And there are others. The Serge said earlier, she mentioned some of the things that you could do. So, keeping mental health is very important. So, at any point that you feel you are suffering with some of the symptoms we mentioned earlier, you go back to self check and start practicing some of the things that you have heard. Of course, it happens to every one of us where we can live with poor mental health. So we need to make sure that we're on point and do some introspection. What do you think, Miss?
Yes, we also, that is one way we need to check on our mental health. How are we doing? And then if we need help, reach out for help. And when we say reach out for help, we have a mental health clinic at each of the health centers on Island District Hospital. There's a mental health clinic. There's also the National Mental Wellness Center where you need to get a referral to go there. They have the private practices. They have the National Helpline 203, which is free.
Yeah.
And also some of the churches have persons you can go to. So help is out there. So you need help, you reach out for help. And the same way you go to check your physical every year, come and check your mental health also. It's available. And services are free of charge at the health centers.
Definitely. Can you said services are free. The you said you operate from Castries to
Our Castries, Leclerc, Bexor,
okay.
Vanna, and Surrey.
Is there a psychiatric nurse in every district?
They are free mental health psychiatric nurses practitioners for the island. Being why I have so many, they have so many areas. There's three of us.
Three.
So three.
Wow.
So the clinic is once every month at each of the. Some of the places will not have two clinics, but and we also have one psychiatrist that do community, the community, one psychiatrist and one psychotherapist.
Okay. Because I was just going to bring about the point that if somebody feels okay that they have not been feeling well lately in terms of they're depressed all the time, they don't have the appetite, they're not sleeping. I needed to know if they could just walk into the health center or the wellness centers and just go for an assessment to say, okay, this is how I've been feeling. So I've come to just to carry an out assessment to find out, where I'm at, how could I get help and so on.
Okay, some of the district medical officers at the health centers, they have been trained in MHGAP, which is a bridge program, so they're able to treat some mental health conditions, or not necessarily treat, but recognize some mental health conditions. So you can go to your health center. You don't feel it, go to your health center. If your DMO cannot manage, then you refer to the mental health team. Talk to your nurse. If your nurse feels it's something to call the team member, she will call the mental health team. And then they will make arrangements to see you, depending on the urgency of the situation.
Okay, definitely. My next point. You said earlier that there are only 3 of you. Wow.
In the community.
In the community, right. How feasible is it to assist community members with mentally ill patients? Asking that to say, sometimes it is very difficult for a family member to take in a mentally ill person to the institution or to even have them taking their medication. At any point, do you have to go into a home to help, and how feasible is that?
We are hoping that it don't reach that point. Like I said, that the family members come early enough so you don't reach that point. And when you reach the point where they have to go to the hospital, then we would have to ask the police assistance. ask for police assistance. Sometimes we do go into a home to see what we can do, but some of the persons, they don't come to the clinic, so we don't even know who they are, except when they start relapsing. And you find it's difficult to build trust at that stage. So some of them may have to go back to the hospital. And right now, the only agency we would have is the police so far to do that
My next question.
as an example.
Yes. With the police. Yes, I want. Go ahead. Go ahead.
Suppose like in regards to this mental, this is used to pass house to house to check on mental people. And that's what happened again. Like what's really going on, and
She
for people
answered.
that not
She
good,
answered that. Three of them on
yes.
island.
Yes, so she's just saying that. So let's say good morning to Jane Alson, all you guys on Facebook laptop. Viewing, that is. Yes.
Before there was a mental health reform project, I think sometime earlier, there was a 2-year project and they had more persons. So you find there were more persons involved in that project and they can go on. So we have 3 nurse practitioners on the team. We have the psychiatrists, I forgot the health aides. So we have the health aides who go around more time to go around to the different homes.
Okay.
So we still do go
That's
around to
the
the
ladies in
home.
brown?
Yes.
Okay.
Okay.
So we have one
And,
per region to go around.
God bless her soul. I still miss her. We had Miss Peterlin, Jabatis, Vicky. God bless her soul. Who used to be with you on your team, the only psychiatric social worker
Yes.
that I know. Right. So now that she's no longer here with us, and she was doing a marvelous job, because I remembered after she passed, this client came to my office, and let me tell you, I think, I'm not sure if I cried with her or I cried more than her, but she sat in my office and she broke down and she said to me, "My hands are broken. I have nobody again. She was the only person who used to help me and she's gone. What do I do?" And she sat and cried. And after her passing, I don't think that slot has ever been filled.
No, we do not have a community social worker, mental health social worker.
Has a proposal been put in place for that?
That's question up on my paper.
No proposals from you, because
Oh yeah, we have asked. We know that
right.
you've been
This is
asking.
what I'm
We've been
asking.
asking.
Right. No, I'm not saying
Oh,
no. Just
okay.
proposal. Right. Because
Yeah, we've been
I
asking for a
definitely know.
replacement. Yes.
Yes, because it is very important that sometimes, I'm not sure if the higher ups or enough people, they're not seeing the impact of having a full a full team of persons. Because when, like I said, if this lady had not come in to me and said, how much help she was getting and how much is going on, even other cases I've had where the social worker had been called in and you would have been called in as, so a whole team would be there to assist, as
the
opposed
best
to
way.
just one person. It would be more effective than, yeah.
But when you look at our structure, the structure for the mental health team, it needs to be open. We know that it needs to be open to include other persons, and it needs to be restructured so we can add. Because right now, this is the component, this is the persons we have, but then we need to go back and restructure it so we can sort out for the team.
Okay, that would definitely be a help, because sometimes, as much as we have the toll-free hotlines and so on, I think some people feel better in just walking into someone, speaking to an individual face to face as to what is going on with them or how they can be of assistance. How can they get assistance from someone? Yeah. But like we're saying here, listeners, mental health is it's quite essential. Without your mental health, you just cannot focus effectively. So we need to start taking our mental health very seriously. I know that it's late, we're saying it, but tomorrow is actually mental health.
Yes.
So give us some more information about that, nurse.
Tomorrow is World Mental Health Day. It's celebrated October 10th every year. And the purpose of the day is to bring awareness to mental health and mental health conditions. It's bring awareness, and the theme is time to prioritize mental health in the workplace. It's talking about how workplaces should be able to promote mental health, and if mental health persons are mentally healthy, then you have decrease in absenteeism. There's more productivity, and persons are more willing to come to work, to come into work. And also, it talks about supporting persons with mental health issues, having managers know how to support mental health, how to be able to provide the support for the persons living with mental health conditions in the workplace, the stigma against their being employed. These are some of the things the theme is talking to. Physical health.
So very true. And this is why, again, we highlighted, right, some of the symptoms that would indicate that you need to take a breather and take do some activities to help your good mental health. Right.
Yes.
Very much so. Are there any national activities for mental health, especially tomorrow?
Well, since we're looking at mental health in the workplace, we have some sessions for workers on mental health in the workplace. So tomorrow we're having some sessions at the Ministry of Health, and throughout the month we're having different sessions at various workplaces.
Okay. So it is like giving training to some of the employers.
Not necessarily giving the training, but giving information to employees and employers about mental health and how they can look after their mental health, and in turn make the workplace mentally healthy.
Okay, great. So what are the colors associated to World Mental
Predominantly
Health?
green, but there's also some will be yellow, but green and yellow mental
Okay.
health.
So in observance of Mental Health Day tomorrow, it would be encouraging to see persons wearing green and yellow
Yes,
in
it would be.
observance of good mental health.
Yes.
So, Ellen, tomorrow, God's willing, make sure you're wearing your green and your yellow, okay, in observance of
Observers raising the awareness.
definitely
Yes.
of good mental health. All right. So also persons, you can do stuff in your workplace in observance of World Mental Health Day. You could bring a fruit for your neighbor, sing a song to your class, do free blood checks and free pressure checks for me when I come in tomorrow.
Of course,
Do
be a listening ear.
definitely, most definitely, and be your brother's keeper. So reach out to someone you think needs help. Like yesterday, we were having a discussion at a meeting, and somebody indicated that we were speaking of child abuse, and somebody indicated persons need to learn to mind the business. Persons need to learn to mind the business because it's almost like if you know something is not good, why do it? So why do I have to bother to come and report it or tell you it's not good? So I corrected this person and said that I think now we mind our business too much in the sense that we have to be our brother's keepers. We have to reach out to somebody else because it's not everybody. We take it for granted that people know right from wrong or what is required and what is not. Sometimes not. So we have to reach out to our neighbors, reach out to somebody. So, like messages, for example, if you're at work and you see one of your colleagues not being herself, quote unquote, like we say, how would you approach this?
Well, in my experience, some persons, if they're not feeling okay, they come, nurse, as in, okay, nurse, it's my turn first. And they come to talk to you. Sometimes persons are not acting themselves. You just have to leave them alone for a while. Because sometimes it's not about you, it's about them. They need to try and sort out what is going on. So sometimes you will just have to leave them alone, let them sort it out. If they cannot sort it out, then they'll seek help. everybody have a right as to what kind of help. So you cannot force yourself on anybody. So you see they know they self. You see, just give them a little time. Sometimes they just need that little time to catch up with whatever is going on with them, and then. But if you see it's prolonged, then maybe you might intervene and say, "I see you're not doing too well today. Is there any way I can help? Is there any way I can
Yeah.
help you?"
Okay.
Something like that.
Especially to a colleague who you know well and you work well with. This person comes and they're not, you've been observing, because like you rightfully said, you have to observe, and you've been observing that this person has not been themselves for a day or two. This is the time you would reach out, right?
Yes, Richard. I see you not being well over that. But what can I do to help you? Offer help. What can I do to help?
Okay, definitely. So thank you so very much. We've had Nasejes giving us much information. At this point, I would invite anybody to call in, make a contribution, make some remarks, dialogue with us as to World Mental Health. How do you feel at this point your mental health is? Are you in good mental health? So anybody out there, you could always reach out to us and let us know. Typing, right? It would have been awesome for somebody to call in. Okay, thank you, thank you so very much for that. Yes. So, Nasejes, what days are you in the vicinity of Sufresh Ruzel?
I can tell you the days they have a clinic.
Okay.
There's a clinic at Lafargue. The doctor attends every first Thursday. The psychiatrist is there. Every second Thursday, the psychiatrist is at Soufrière Hospital. First Thursday at Lafargue,
First Thursday.
second Thursday at Soufrière Hospital. Before we had a clinic at each of the health centers in the region, but now since they do not have a nurse attached to Soufrière, it's only for sure these 2 days you'll get. But if it is a situation, you go still speak to the nurse will give me a call, and we see how best we can address the issue.
Okay. So there's no, so you say, so there's no nurse assigned to.
No nurse assigned. The
The
nurse that was assigned
regions.
resigned, and they have not found anybody as yet to fill in the position.
Okay.
So we lend assistance. So if there's something, we would lend assistance to the
Okay.
to
Nice.
Soufrière.
Good. Very good to know. All right. So can you again brief us on some of the places that persons can reach out for help? Well, when they feel that they definitely need to reach out.
Okay, so first of all, sometimes issues are not so much so that if we reach out to a friend, we don't feel better. So we can reach out to your friend, you can to your family member. We can go to the churches, your pastors, some of the pastors. Then we can come to the health centers. We can go to the mental wellness center, and they also have some private counseling agents and psychiatric areas on board. So sometimes it's a simple. Sometimes we just need to talk out. So sometimes we meet the friend, and if then we see okay the issues are not resolving, then we go to the higher levels.
Okay. Very good to know.
And 203, the national helpline.
And the
203.
National Helpline 203.
Yes, 203.
Yes. Okay. So agencies that you can reach out to, you have the Division of Human Services. And it's so surprising to hear persons reach out to me and say, I never knew that there was a Division of Human Services in Soufrière, and we have been there for so long. So pardon? It has been there for very long. So everybody who knows the boutique Miss Sandra, I am directly opposite Miss Sandra's boutique in same building with Peter Management, higher up Westick. I think it's Victoria Street. Lower Victoria Street. Right. So my office is located here. So we are open from Monday to Friday from 8 o'clock to 4:30 p.m. Even if I am not in, there will be someone in to assist you who can take your information, and then I will reach out to you afterwards. So persons feel free to come in to get help, even if I cannot help you personally, but I can redirect you. So of course you can reach out to us. And in my office, we have the SSDF officer, we have the welfare officer. So you can come in to get help from any one of us. As I said, if we are not there at this given time that you were there will be someone to assist you. We could take the information and reach out to you later. Like Nurse just said, you can walk into a hospital, try to get the information. If there is not anybody to help you at the hospital, somebody will take your information and contact you after. So you have your wellness centers, you have your hospitals, you have the 203 hotline, you have the crisis center, you have many places to call. And if you cannot remember anyway, call a friend, let somebody direct you as to where you need to go and what help. But do not stay and say, okay, this too shall pass, and I will do it on my own, and I can get it done on my own. Sometimes you really cannot, and you need the help.
Another place for government employees is the Employee Assistance Program. They too offer services, counseling
Yes,
services.
the government
For
employees,
government employees.
right? So that's the Employee Assistance Program, definitely. Okay, yes. So any closing remarks, Nurse?
Just for persons to remember that when they hear mental health, I want them to think of how they feel. So when they ask, "Oh, how is your mental health?" So don't say it doesn't have anything to do with me. I'm feeling okay. I'm feeling okay. I am able to cope. Okay, it has to do. Remember, it has to do with you, and you don't want to look after your mental health. So, okay. So practice self-care activities, gratitude. Look after your mental health. It's your responsibility.
Definitely. Thank you so very much, Nurse Segis. And
Thank you for
listeners
having
out
me.
there, you heard that. And it begins with you. You practice what you preach, you lead by example. So if you want to make somebody laugh, start laughing. So they will follow you and laugh with you. Okay. So definitely. So don't tell me laugh and then you're all grumpy. And so you lead by example, practice what you preach. So by thinking positively, you can impact positively. Okay. So please take good care, take care of your mental health. Tomorrow, God's willing, please wear your green, wear your yellow in observance of Mental Health Day. Thank you so very much.
Thank you.
All right. And of course, with that being said, we are 4 minutes after the hour of 12 million. That right there was Family Matters. Tune in next week, Wednesday, from 11 up until 12 for another edition of Family Matters. Let me take time out to thank everybody who's locked on, all right? Whether you're at Forbenier, you're at Diamond, you're at Zeno, wherever you are, I want to thank you for all you make the small contribution goes a long way. Hey, Mafa, hey, Jane Alcindor, big shout out to all you. Okay, again, thank you, thank you, thank you. Till next time, God's willing, take good care of yourself and others. We're out of here inside. All right.
A wholesome and relationally healthy family is an integral foundation for a strong community and nation.